The year 2025 brings remarkable breakthroughs in dementia prevention and early treatment that offer genuine hope for protecting cognitive function throughout aging. Medical researchers have made significant advances in understanding how brain changes begin decades before symptoms appear, creating unprecedented opportunities for interventions that can meaningfully slow disease progression. These developments represent the most promising era in dementia research, with new treatments, prevention strategies, and early detection methods becoming available to individuals and families concerned about cognitive health. Early detection enables interventions that can significantly slow progression because the brain changes that cause symptoms begin 20 years or more before obvious cognitive decline becomes apparent. This extended time frame provides a substantial window for implementing protective strategies, while the brain retains considerable capacity for adaptation and resilience. Research demonstrates that interventions started during this preclinical phase prove far more effective than treatments begun after symptoms have already developed, emphasizing the critical importance of recognizing early warning signs and acting promptly to preserve cognitive function. Up to 40% of dementia cases may be preventable through lifestyle changes, according to the Lancet Commission research examining the effectiveness of comprehensive prevention approaches. These modifications focus on three key areas that provide the greatest protective benefits: regular physical exercise, healthy nutrition, and sustained social engagement. The combination of these lifestyle factors creates synergistic effects that exceed the benefits of individual interventions, suggesting that comprehensive approaches provide optimal brain protection throughout aging. Physical exercise serves as one of the most powerful interventions for brain health because it improves circulation, increases brain oxygenation, and stimulates neural growth factor production. Regular aerobic activity including walking, swimming, or cycling for at least 30 minutes 5 days weekly helps maintain healthy blood flow to brain regions essential for cognitive function. Exercise promotes neuroplasticity, the brain's ability to form new connections and adapt to challenges, while also reducing inflammation and supporting healthy aging processes throughout the nervous system. Strength training provides additional benefits by maintaining muscle mass and supporting the neural pathways that connect brain motor centers to peripheral muscles. Nutritional approaches emphasizing Mediterranean and MIND diets provide brain protection through foods rich in antioxidants, healthy fats, and anti-inflammatory compounds. These dietary patterns emphasize vegetables, fruits, whole grains, fish, nuts, and olive oil while limiting saturated fats, red meat, and processed foods. The Mediterranean diet has shown particular effectiveness in reducing cognitive decline risk because it provides omega-3 fatty acids that support brain cell membrane health and antioxidants that protect against cellular damage. The MIND diet combines Mediterranean principles with specific foods that research has linked to cognitive protection, including leafy greens, berries, and nuts that contain compounds directly beneficial for brain health. Social engagement supports cognitive health by providing mental stimulation, emotional support, and sense of purpose that contribute to cognitive resilience and psychological well-being throughout aging. Maintaining meaningful relationships and community connections challenges multiple brain systems simultaneously, including language processing, emotional regulation, and executive function. Social activities often involve learning new information, solving problems, and adapting to changing circumstances that help maintain neural pathways crucial for cognitive health. Regular social interaction also provides emotional benefits that reduce stress and depression, both factors that can accelerate cognitive decline when left unaddressed. Specific cognitive training programs have shown remarkable effectiveness based on 2025 clinical trials that demonstrate measurable improvements in cognitive function and daily living abilities. These programs focus on building cognitive reserve, which refers to the brain's ability to maintain function despite underlying neurological changes. Higher occupational complexity associates with better cognition among individuals at increased risk of dementia, suggesting that mentally stimulating activities help sustain cognitive abilities and delay symptom development even when brain changes are present. Recent cognitive training research reveals that programs challenging multiple cognitive domains simultaneously provide superior benefits compared to single-domain approaches. Training programs that combine memory, exercises, attention tasks, problem-solving activities, and processing speed challenges help maintain neural networks throughout the brain. Participants engaging in comprehensive cognitive training show measurable improvements in daily functioning and slower rates of cognitive decline compared to control groups receiving standard care alone. Updated statistics on early intervention outcomes demonstrate significant quality of life improvements for individuals receiving comprehensive care during early stages of cognitive decline. People who participate in early intervention programs maintain independence longer, experience less distressing symptoms, and require fewer intensive care services compared to those receiving treatment only after advanced symptoms develop. These outcomes translate into substantial benefits for both individuals and families dealing with cognitive health concerns. The statistics reveal that early intervention can delay nursing home placement by an average of 18 months while reducing caregiver stress and improving family relationships during the progression of symptoms. Financial benefits also prove substantial, with early intervention reducing healthcare costs by approximately 30% compared to traditional approaches that begin treatment only after obvious symptoms have developed. New medications and therapies work best when started early in the disease process, with recently approved treatments showing promising results for slowing cognitive decline. Lekanumab and donanumab represent breakthrough medications that target and remove beta-amyloid from the brain, addressing one of the fundamental biological changes associated with Alzheimer's disease. These drugs receive approval for individuals with mild cognitive impairment or mild dementia due to Alzheimer's disease with confirmed elevated beta-amyloid levels in the brain. While these medications do not cure Alzheimer's disease, they demonstrate the potential to slow disease progression when started during early stages of cognitive decline. The effectiveness of these treatments beyond their clinical trial periods continues to be established through ongoing monitoring systems that track health outcomes for people receiving these medications. Healthcare providers now have tools for explaining treatment eligibility, risks, benefits, and costs to patients and caregivers considering these therapeutic options. Recent research on combination approaches reveals that integrating multiple interventions provides maximum cognitive protection benefits compared to single intervention strategies. Ongoing trials target amyloid, tau, and inflammation, addressing the multiple biological processes involved in dementia development.